Now, News Extra brought to you by the Gehring Civic Center. And here again is Kevin Mooney.
Thank you very much, Dennis. Good morning, everyone. We're probably going to teach you a little something today on News Extra. We're going to talk to a couple of folks in internal medicine at Regional West. They're going to tell us exactly what they do. And we have Dr. Sero here. He has a longer name than that, but Dr. Sero is much better, much easier to say than his. What is your, kind of tell me what I should be saying for a real name.
So my name is Serozan Amroliwalla, but I go by Dr. Sero.
Oh, yeah.
It's a lot easier.
A lot easier, yes it is. And Haley Nielsen, she is also in internal medicine. She's a doctor of nursing at Regional West as well. So Dr. Cyril, tell us about internal medicine, what it is at the hospital. It's totally different than, say, a regular general practitioner, right?
That's absolutely correct. So a regular general practitioner, if you will, are your family medicine docs, and they see kids and adults also. And it's basically like a life-to-death kind of relationship that you have with your family practitioner. In internal medicine, we have different training in terms that the length of the training is no different than family medicine. It's still 3 years, but the focus of the training is solely based towards adults. So it's adults 19 and older. And we also have more advanced training in the hospital side when you're admitted to the hospital and taking care of patients in the ICU and with multiple comorbidities.
Yeah. So there's multiple things you take care of. Maybe
Correct.
have a little more knowledge than, say, the general family practitioner would, right?
That is correct, because during our training, like I said, it's geared again towards adults, but a lot of the months and trainings are spent solely in the hospital, where most of us are when we're really fairly sick, and also in the ICU. So we see patients with heart disease, respiratory problems like COPD, asthma, kidney problems like chronic kidney disease, kidney stones, just to name a few. And then also patients with thyroid problems, diabetes, and cancer prevention and comorbidities.
All right. So quite a few of those. Mm-hmm. And here, most of you do see some young people, but our demographics maybe a little more of the older patients.
I would say a majority of the patients I see in my practice are 40 and older. And I would say about 70 to 80% of the patients that I see are 60 and older.
Wow.
Yeah.
So when you're seeing these older patients, they're probably, when they come in to see you and they're in the hospital or in the ICU or something like that, I mean, they're having some serious problems, right?
Absolutely. And, again, their needs are totally different than someone that's healthy in their 20s or 30s. And, again, some of the screening programs that are out there for adults are a lot different than, people that are younger. So it's all about prevention, too.
Yeah, and that's probably one of the biggest things you try to provide when you're seeing these folks, right?
Absolutely, because a lot of times these chronic illnesses go hand in hand. So if you have one and you don't treat it adequately, diabetes, for example, millions of Americans suffer from it. But if it's not well taken care of or well cared for, you can lose your vision. You can end up on dialysis. So you want to prevent the complications of these diseases. And that's essentially what we are trained in and experts in internal medicine.
Yeah, trying to kind of fight that and make sure people don't get...
Right. And it's also a lot about patient education and teaching them, lifestyle modifications, which at times is the hardest to get across.
Yeah, it is for many people.
Absolutely.
That's right. All right, we'll be back with more right after this.
Having food that is consistently great, event after event, is something worth talking about. The Gehring Civic Center serves incredible food, and food makes a great event. Along with our catering partner, the Meat Shop, we have been hosting special events for over 24 years. In our elegant column-free ballroom, there is no room rental fee if food is purchased. Visit GehringCivicCenter.com, call 436-6888. The Gehring Civic Center, the center of it all.
All right, we're back on News Extra today. We're learning about internal medicine with Dr. Sero and also Haley Nielsen, who's a doctor of nursing over at Regional West. Now, you're training Dr. Sero went through probably different residency training, say, than you did, right?
Yep, that's correct. Dr. Sero went through 3 years, maybe even plus, of specific training in internal medicine. And most of us who are nurse practitioners have gone through more generalized training. So, for instance, I'm a family nurse practitioner, so I've been trained from life until death. And now that I'm done with school, my practice is specialized in adults 19 years and older. But there are a few nurse practitioners in our practice that are adults specifically trained as well.
Do you spend most of your time in a clinic or at the hospital, or?
Yeah, so most of my time is actually spent in internal medicine. Right now I don't do anything in the hospital, but there are some nurse practitioners over there that work with the hospital services that are also considered internists.
All right. So you would have patients that come see you, and they're in some of the same things that Dr. Sero is treating, right?
Yep, that's correct. So in internal medicine, we have our own panel, and then as nurse practitioners, we also help the physicians with some of their overflow. So as their panel gets bigger and they have patients who need to be seen, we try to see them in internal medicine just because these are more complex patients. So if we can keep them out of the urgent care, where we can look at the medications that they're on, just making sure that when we're treating, even if it's a common cold, we don't want to put them on a medication that could potentially be harmful to their health with some of the medications that they're on to manage their more chronic illnesses. So we have our own panel. So I have my own panel of patients, but I also help to see some of the physicians overflow as well.
All right. How many internal medicine physicians, how many, say, nurses like you are at the hospital?
So nurse practitioners, I'm not sure. There's 13 physician and advanced clinician practitioners in our clinic alone. I would say that we're probably almost 50-50, or maybe a fourth to three-fourths in each specialty. So there's subspecialties within internal medicine. There's oncology, and oncology has a couple nurse practitioners working for them. The diabetes clinic is ran by a nurse practitioner. In pulmonology, we have a pulmonologist who's a physician, and we have a nurse practitioner who sees patients with a pulmonologist in pulmonology. And then we have physicians in endocrinology and gastroenterology as well. And then just for primary care purposes for internal medicine, we're actually split 50-50. There's 3 physicians, and then there's three of us who are PAs or nurse practitioners.
All right. Do you work mostly just the weekdays, or is there weekends too? How does that work?
Yeah, so we mostly just work weekdays, Monday through Friday, and then we actually take outpatient calls. So our patients, if it's ever after hours during the week or it's on the weekend, and a patient has a question, there's one of us providers who's on call, and we rotate. That way we can take the call. But there is some of the physicians that will work after hours in the hospital as well out of our department.
All right. Very good. So, I guess just give me your guys' phone numbers for more information. People want to talk to you guys.
So the phone number at the clinic is 308-630-2101, and that will just get you to the main office of internal medicine to get scheduled.
All right. Is that right? Same thing?
Yep, that would be the number you would call, make an appointment, and majority of the times we could get you in the same day with one of us.
All right, very good. Thank you very much, Dr. Sero.
Absolutely.
And,
Thank you for
Haley
having
Nielsen.
us.
We appreciate it. Thanks for the education today.